And you have to clean the stethoscope with the alcohol pad, of course. And the stethoscope you have to put on the...
Under the system.
Where you should put it?
Under the tube.
Why? What is there?
Vein.
Brachial artery. Yes, because we have to listen for the sounds. We have to listen systole and diastole. And the sounds is giving us the artery, not the muscle, not the vein. Yeah? That's why first we have to, with our hands, touch here and find the artery, find it where it's beating. And where it's beating, there you have to put the stethoscope. And after this, you start close the balloon, okay, and start pumping. And you will go till the 150 because you got this number when you weighed 14, right? At the number where the pulse disappeared. And from 150, you will start listening for the systole and diastole. From the beginning, there will be silence. Then there appears this sound, beeping. So the first sound when appears, this is the systole. Maybe it will not be this much clear sound. Maybe it will be faint. Okay, but still the sound. This is still the systolic. Then it becomes more clear. And the last sound, this is the systole. And you need then the last sound. Last sound, it means that when you diastole, when you heard the beep, and after this, it stopped. It means that this last beep was the diastole. Okay? After you will listen for the systole and diastole both, you have to open the balloon fully, deflate it, remove all the equipment from the hand, tell the patient, inform the patient about his pressure. You have to say the systolic over diastolic, what was his pressure, and clean the equipment, leave the room if the lecturer is not asking you anything. Okay? Maybe the lecturer will ask you, for example, 145 over 85, what kind of pressure this is? What you will say?
No.
Is it the stages, I mean?
Second stage hypertension.
Oh, first.
Second stage hypertension.
First.
You said that 120 is stage 1 and
145 over 85, what is this?
It's not right.
not
First stage.
Is high, whereas the
First
diastolic is
stage.
normal.
First stage. This is the first stage.
So after one
Second stage is 160 and above 160.
is
140, above 140 till 159, this is the first stage. 120, above 120 till 139, this is a pre-hypertension. 120 over 80, this is a normal, and then less than these numbers, they are normal. Okay? Someone will have 110 over 70, it is a normal too. Someone will have 120 over 80, I have 100 over 60, this is my normal. Okay? So what we did? Open the door, introduce yourself, explain the procedure, say that you wash your hands, ask the patient to sit down, gather the equipment, clean the equipment, ask the patient, be sure that 30 minutes earlier he didn't do anything that makes his heart makes his pressure to go high. Then take your cuff, put on the hand above the cubital. I have to put the cuff above the cubital fossa. Now I have to find the radial pulse because I need to get the number. And while pumping, I have to remember the number where the pulse will disappear. And after the pulse will disappear, at that number I have to add in my mind 30 or 40. And this is the number that I need while measuring the blood pressure. Then I have to deflate the balloon. I have to wait 30 minutes to 30 seconds. So this is for hand to keep calm, to rest, because it was under the pressure. After 30 seconds, I have to take my stethoscope and put on the brachial artery, and I will start pumping again, and I will go to that number where the pulse disappeared, and I added 40, for example. I got the number. To that number you're going, right? And from there, I will start listening systole and diastole. First sound is systolic, last sound is diastolic. Then I have to inform the patient about the pressure. You have to remove everything from the hand, clean it, put on the table, and leave the room. This is what you have to do on the X. Okay? And remember that cuff always must be done on the soft skin, not on the clothes. Okay?
I have a question.
What? That's why I put the checklist. There's written the steps we have to measure. And you remember about blood pressure? What do you remember about blood pressure measuring from the clinical skills 1?
Normal pressure is 80 to 120.
Systole over diastole.
Yes.
120.
120 or 2.
system
120 over 80 and
What?
normal.
That's normal, yes.
Less than these numbers, they are the normal too. 115 over 70, this is not normal. For me, 100 over 60 is normal.
No. How can that be?
Huh?
How can that be? 100 by 60, it can be.
Yeah,
So, but
this
you
is my
consider
normal.
120 by 90 as like stage 1 hypertension. Then how not?
So 120 over 80 and less than this is normal. From 120 to 139, this is a pre-hypertension. From 140 to 159, this is a stage 1. And 160 and above 160, it doesn't matter, this is 170 or 200. This is stage 2. Okay? About the procedure. Okay, imagine you enter in the room. What you will do first? Introduce yourself, explain the procedure, say that you wash your hands. You cannot put the gloves on your hands, just wash your hands, keep the hand hygiene. Then you have to gather the equipment that you need. What equipment we need?
The stethoscope.
Name. This is a stethoscope and
Sphygmometer.
huh?
Sphygmometer or the sphygmometer, I guess, right? What is it?
Sphygmomanometer.
Sphygmomanometer, yeah. What? Well, cuff. So like shortly we call it cuff, but this is a sphygmomanometer. And on the table there you will find the alcohol pads too. In your checklist there is written that before you will start using the equipment and after you will finish the procedure, you have to clean the equipment, okay? Well, this is just because of hygiene, because before you there was a student, he used it, and after you, there must come the student, and he will use the same equipment that you used. Okay. So before you will start, you have to clean it because you don't know what previous student did, and after you will finish, you have to clean and leave the clean equipment on the table. Okay. Well, introduce yourself, explain the procedure, wash the hands, take all the equipment that you need, clean the equipment. Ask the patient to sit down because the procedure is in the sitting position. We're doing right. So sit down. The patient must sit straight without crossing the legs, and hand is on the table, right? So which hand we are using for measuring the blood pressure? Do you remember? Left, right?
Right.
Why?
Both hands different.
So
Blood pressure.
It's more accurate than the.
so if the patient is coming and he's the first time, you have to measure on the both hands, and on which hand you will find the highest pressure. You should inform the patient that during your life, please continue measuring on this hand. On the left, on the right, you will never find the same pressure. There always is maybe small difference, but still the difference. Maybe here will be 110, here will be 115. Why? I shall always continue on the this hand because there was 115. Okay? So we are measuring the blood pressure where there is the highest pressure. Okay. So patient sit down, and before we start measuring the blood pressure, again we have to ask now the questions. The questions about his activity before coming to you. So you have to you have to be sure that 30 minutes earlier the patient did not drink tea, coffee, did not smoke, did not run, did not do any kind of exercise, did not smoke. So 30 minutes earlier the patient should avoid the things that makes his heart work hard. Okay? Because if before coming to you he was running outside because he was in a hurry, and you will measure the blood pressure, it will be high. So but it will be wrong number, right? So that's why 30 minutes earlier he has to avoid this kind of things. Then you have to start the procedure, and you have to take your cuff, and we have to put cuff on the hand. Which part we are using the hand? Where we are putting the cuff?
The arm.
How about the brachial artery?
What fossa we have here?
Cubital fossa.
Cubital fossa. Above the cubital fossa.